Hi, everyone. My name is Warren Scott. This is my presentation. And for my mock case study, we are going to be doing therapy with Rosie today. Rosie is 4 years, 3 months old. Her diagnosis is ASD. Primary concerns are expressive and receptive language delays, limited functional communication. Currently, we do 30 minutes a week individual therapy. For today's mock trial, we will attempt 5 minutes. Client background and history. Rosie is bilingual. She speaks Spanish at home and English at her preschool. She lives with her mom and dad and grandmother, so there's strong family support at home, which is convenient when doing therapy. Her mom usually sits in on the sessions with her and assists with things on that side. Currently, she communicates through gestures, single words, and AAC. Strengths. She is great with visual learning. She enjoys music and routines. She does get frustrated when she's unable to communicate. Her family wants her to improve her communication and greetings. As far as cultural considerations go, family values politeness, respect, and participation, especially in therapy sessions. Her mom and dad use visuals and the AAC at home. Her grandmother communicates with her verbally. Therapy uses bilingual and family-centered approach, collaboration for generalization and carryover. After therapy sessions, I'm usually able to communicate with Rosie's mother and talk about things that can be done at home or continue to be used. Long-term goal number one, Rosie will use AAC or verbal speech to make functional requests and comments with 80% accuracy. Short-term goal, request preferred items using AAC or verbal in 80% of opportunities. Short-term goal number two, use two-word combinations with 70% accuracy. One-word combinations are currently around 80%, so this is a short-term goal to expand to two words. She will also answer simple WH questions with AAC device with 80% accuracy. As far as her receptive language goes, Rosie will follow two-step directions with basic concepts with 80% accuracy. She will also follow one-step directions with visuals or verbal cues with 80% accuracy. On one step, we've had the last two sessions have been 80%. Currently, with two-step directions, she's probably around 50%, and so we're continuing to work on that as well. She will also be able to follow two-step related and unrelated directions with 70% accuracy for related and 80% accuracy for unrelated. Objectives for the lesson plan. We want to increase expressive and receptive communication through AAC and structured play with Rosie. A normal session length is 30 minutes, but for today's mock trial, it'll be 5 minutes. We like to use play-based visual supports, lots of repetition, and AAC modeling. Sometimes we also let Rosie use the AAC device on her own to respond. She enjoys doing that. Typical session will be a 5 minute greeting, and then we do a warm-up song. Then we usually do 10 minutes of WH questions on the iPad with a nice little WH game we have. Then we'll do an interactive story of some kind, and I'll ask questions to Rosie, and she'll try to respond. On occasion, she'll need a sensory break for the longer sessions, probably not for this mock session. Uh, oh, sorry. And then we will end it with talking with Rosie's mom about what can be done at home. Materials and tools, iPad with WH question. TD Snap is the AAC app that we use. A storybook with clear visuals, or it can be a verbal story. Picture visuals, colors, actions, prepositions. Choice board for sensory activities is optional. After each session, I provide routines that can be done at home. I encourage AAC modeling at home. And anytime Rosie's mom or dad have questions, I teach them how to prompt with the device or how to expand on things they need to expand on. They also ask sometimes how to reinforce bilingual use in meaningful settings with AAC device, so I walk them through those steps after each session. I see if they have any questions. These are the references for today's presentation. Okay, I'm going to stop sharing. And now, Rosie, will you go ahead and turn on, or Rosie's mom, will you help her turn on her camera? Hi, Rosie. How are you doing today? You doing good today?
Good.
We're going to do a song today to start. Are you ready, Rosie? So try to follow me best you can. And I know your mom's helping too, off camera, right? If you're happy and you know
Happy,
it, clap your hands. If you're happy and you
happy,
know it, clap your
happy
hands.
here,
If you're happy and you know
happy,
it and you really want to
on the
show it.
show,
If you're happy and you know it, clap your hands.
happy,
If you're happy and you know it, wave your arms. If you're happy and you know it, wave your arms.
arms,
If you're happy and you know it,
happy,
and you really want to show it, if you're happy and you know it, wave your
mm,
arms. Good job. Can Rosie's mother, will you go ahead and help her share her screen so we can get a look at her device? And we're going to do the WH game first. Yes, there we go. Good job, Rosie's mom. It's sharing. And now, if you could just go to the WH game that we had talked about earlier. And go ahead and press play on that and start. Okay, Rosie, I'm going to tell you what to feed the shark first, okay? First, I want you to feed the shark a blue blueberry. Rosie, where is it cold? Oh, not cold on the beach. Where is it cold? Good job. Okay, now I want you to feed the shark the red, yellow, and orange jelly beans. Rosie, what do cowboys ride?
horse,
Good job. Which one is the horse? Good job. Now, Rosie, this one is silly, but will you feed the shark a brown boot? When do you wear a swimsuit?
water,
Water. You wear a swimsuit when you're near water, right? Like the beach or the pool. Rosie, will you feed the
yes,
shark the red snow cone?
see,
What do you color with, Rosie? What do you color with? Do you color with
crayon,
Yeah, very good. You color with the crayons. Which ones are the crayons? Good job, Rosie. Okay, now Rosie's mom, will you go ahead and open up her AAC device so we can get a look at that? Very good. So right here, what we have her greetings down there at the bottom, the ones we're working with on the AAC device. Rosie, what do you press if you need help? Rosie, what do you press if you need help?
I want
Okay, Rosie's mom's gonna have to step in here. Go ahead and take her back to the home page. Rosie, what do you press when you need help?
help help
Good
Hmm.
job. What do you say when you're seeing someone for the first time?
Hi.
hello
And what do you say when they're leaving?
Adios.
bye
Good job. And what do you use when you need some time alone?
I want
Not once, remember?
want a break
Good job.
want
That's
a
what you
break
say.
want a break
Now, Rosie, um, let's give you a small break. What do you want for your break?
I want dull dull
Okay, Rosie's mom, will you go ahead and give her the doll and we'll give her a 10-second break with the doll? Now, normally when we have a 30-minute session, the break would be longer, up to 5 minutes. But for this mock session, it'll just be a 10-second break with the doll. Rosie, can I see your doll?
So,
Rosie, will you please show me your doll?
tall,
dull
Wow.
dull
What color is the doll's
paper
jacket?
paper paper
low,
Yellow? Very cool, Rosie. Okay, Rosie, go ahead. We're gonna pretend the session's over now for now. I'll see you another time. Go ahead and turn off the camera if you wouldn't mind,
pen
Rosie's mother.
pen
And that is, let me see. Rosie, will you stop? Oh, thank you. So that is the rest of the presentation. I hope you guys enjoyed it. This one was a lot of fun to record and to do and to walk through the steps. It really helped with my understanding of telepractice and how to incorporate a session via Zoom specifically. Hope you guys all have a wonderful day.